with cast are dicubital ulcers. So there's two ways you get dicubital ulcers. Write this down, two ways you get dicubital ulcers. Not enough padding or movement under the cast. So if you put too much padding on it, you'll get movement. If you don't put enough padding, you'll get dicubital ulcers. Okay, so it has to be just the right amount of padding. So I see people with casts that are this big, and that defeats the purpose, because then you're not immobilizing the leg. So anywhere between 4 to 6 layers of your cast padding, and then you're good to go with your cast. All right? I don't know. I can't put it on from the table. We'll do it from this direction. We'll keep them on here. We use the casting material now is almost ubiquitously fiberglass. Everybody uses a fiberglass cast. And you can use plaster of Paris. It's a lot cheaper. These are about $10 a roll. Plaster of Paris is about 50 cents a roll. But the plaster of Paris is a lot heavier. Okay, that takes longer to set. Again, these animals are mostly going to be anesthetized. You're gonna line up your fracture or do whatever you need to do. It might even be post-op. You may be taking an X-ray. You can take an X-ray through a fiberglass cast, which you cannot through a plaster cast. Okay, and this is it has it's self-adhesive. I got it. And this is what is soft and spongy. When you buy these, they're only good for about 6 months or a year. They get harder. You can delay that by keeping them in the refrigerator. So I usually put them in a vegetable tray in the refrigerator, and that keeps them longer. Okay. And what you need to do is, because they will stick to the gloves, and you will not be able to roll the casting material. They used to sell it with a little thing of cream that came with it, but now they've eliminated that. Get some hand cream, something that's hydrophobic, excuse me. Get something that's hydrophobic and coat your gloves, just any hand cream, and now the cast material will not stick to your gloves. Okay? And same principles of wrapping. You douse it in the water. Ooh, that's going to be warm. You just want it. You want it room temperature. If you put the water in too hot, like this is a little warm, it's going to set really fast. So you don't squeeze it. You just drip it out. Okay? And again, this stuff's very strong. You only need 2 to 3 layers, okay, to make a cast. We'll probably, and I don't want to put a lot more on that than that.
So you'd probably put towels down so it doesn't get on the other foot?
Yeah, it doesn't matter.
It doesn't matter?
It's not going to set up without the.
Oh, okay.
Material.
I just didn't know if there was casting material in them.
Okay, so that's 3 layers. That'd be all you need for the cast, okay? So I'm going to go up the leg. So that's 2 layers, and I'm going to go down the leg for my additional layer. Then we'll go up here for 3 layers. 3. Now I'm going to go down the leg for 1 additional layer. And there we have our cast. Where's our scissors?
So what you guys are getting to the casting pattern?
That is not enough. And it's a exothermic reaction. So from your chemistry, what does that mean? It heats up. So this will get hot as it.
Now, why would you use a cast? Like, when would it be appropriate?
Don't touch.
Well, again, it's better immobilization than a splint. Okay? Not particularly good for very young animals. You can probably get away with splints with young animals. A, they heal faster, and B, they grow out of the cast. So if you have a mature animal that has a fracture, can't afford surgery, then you probably want to go with a cast versus a splint. You get better immobilization. They're not going to grow out of it. This is going to last 4 weeks, where a splint, the most you can get is 2 weeks. Okay? And you're going to have to anesthetize all of them for both of them to get it done right. Okay? And again, you can set the leg, get your cast padding on, go x-ray it, make sure you've got it in the right place, then come back and put your cast on. Or sometimes I'll do this right in x-ray. I'll put them on, anesthetize them on the x-ray table, put my cast padding on, take my picture, adjust it, and then put my cast on right there on the x-ray table. So I'd bring them back and forth to x-ray. So you can see this, so
I feel it now, it's starting to harden inside.
look how fast it's hardens.
And what tool would you use to remove the cast?
Oh, funny you should ask.
Touch it.
Did I hire her as a straight man?
This is Alicia touching it.
This is a striker cast saw,
Oh my god, it's so cool.
and this is about a $400 item. However, if you go to Harbor Freight, you can buy the same thing for $19. That's a tool. You guys seen Harbor Freight?
Love
They're
them.
the cheap tool place. Or any store, I think Home Depot, they're like $69. It's called a variable speed well, this one's not even variable speed. The ones at Home Depot are better. This is single speed. It's an oscillating saw. So what does that mean? Well, the blade, instead of rotating, goes back and forth. And it would scrape you, but it won't really cut you. Okay? So this is an oscillating saw. This is Stryker. I actually saw Mr. Stryker's house on Gull Lake in Michigan. Huge mansion. He made it off of orthopedic equipment. I went back there when I was meeting with the W.K. Kellogg Foundation to get more money for our horses. So this is a Stryker saw, and so once the cast is hardened, again, they're going to have to be anesthetized to do this. And it's pretty hard to cut the animal with this saw because, again, it doesn't rotate, it just oscillates. Hopefully, the saw's not off.
There's,
Oh,
across
yeah.
the table, there's some more clips behind.
He did, but then the same
There's one over there, by the blue tree.
This was working last time I used it, wasn't it?
Plain nose is.
Good, well, you said.
So you have to cut the. In our CE class, if you want to take that in the fall, everybody gets to put one on and take one off. We had quite a few new graduates in that class. Okay, then you need to do it on the inside. Normally you don't do the dog's leg like this, okay? This isn't as easy as it looks. I'm just highly skilled. To see, the tendency is for this thing to run all over like that. Okay, once you've got it cut like that, you don't want to set it on the table because it'll run all over the table until it stops. I speak of experiments. And then this is called a cast. Don't do that. It's called a cast spreader. And sometimes you can cut just one side and then use that to. Otherwise, once this is actually dried and stuck to that brown gauze, it's a bear to get off without a cast spreader. And you can see that just pulls her right off, and then you use your scissors to cut away the brown gauze. And you can see this is anybody wants a souvenir that you can take home and put on your bedroom wall or something. Surgery class.
Sign it, yeah, you have to sign it.
Oh yeah, you gotta sign for it.
Well, that might be valuable, then it'll be on eBay. Anyway, you can see how rigid that is.
He's here, Jerry. Smile, Alberto, with your singing.
Yeah, and that's not completely set up either. I mean, it'll get a little harder than that yet in another hour. But you see, that's how many layers. You don't need any more layers. I see people putting these casts on. They put way more layers than they need. That stuff's pretty tough. You couldn't break that if you tried to, you know? Pretty cool, huh?
Any questions? Now it's
it's time to ask him any questions from the beginning, simple bandage, all the way to cast. Go for
From the
it.
beginning of the program.
Obviously, if there's a wound or anything like that, you wouldn't be able to apply a cast.
Well, you usually never put a cast over a wound, that's correct. Because you need to be able to evaluate the wound, and when you put a cast on, it's gonna be 4 to 6 weeks. So that's a good point. We never put a cast on over a wound. Now, there's some tricky things you can do. For example, if you have a really bad wound and you want to medicate the thing 2 or 3 times a day, you can take a piece of IV line and put it down in between your layers of your cast padding and have it end on the wound. And you can take a syringe and have the client flush medication or antibiotics into the wound daily, something like that. There's another bandage called a wet-dry bandage where you take saline and you apply it next to the wound, and it draws the fluids in the skin toward the surface, and it speeds up healing. The problem with the wet-dry bandage is they have to be changed twice a day. So you put it on in the morning, it has this drawing action during the day, and you change it again at night. So that's only good for a hospitalized animal. That's called a wet-dry bandage. It's supposed to speed healing. There's some relatively new things they're using for wound therapy. One of them is honey. They have medical grade honey that they apply to the wounds. It actually tends to be bacteriostatic. It prevents bacterial growth. And the sugars in the honey provide energy for the epithelial cells to grow over the wound. And they find that honey from different regions works better than honey from other regions. Yeah, so the pure medical grade honey from the area, which I don't know where it is, that actually works on wounds is a lot more expensive than the honey at Albertsons. Yeah. So those are all things you can do. I've done some pretty novel things with wound repair in terms of that. You can do skin grafts, where you have a large area that's healing by secondary intention or granulation. And you can take, and if you have a nice granulation bed, say the wound's a couple weeks old and it's just raw, particularly in horses, we can go and clip and shave and surgically prepare a place in the abdomen and take a biopsy punch. You guys know what a biopsy punch is? It has a little round punch. You probably use that in ClinPath, right? And you can punch out pieces of skin from the abdomen and implant those like seeds in the granulation bed, and they will grow out. But the color will be the same as it is on the abdomen. Okay, so, or you can do a full thickness skin graft where you actually take a patch of skin and harvest it off of the abdomen, sew that wound back up, and then take that harvested skin and put over your wound. So those are all things you can do for chronic wound repair. Is a whole course. It's a whole separate topic, okay? The older the animal gets, the more slowly a wound is going to heal, okay? The less the vascularity to the area, the slower the wound is going to heal. So if you look at vascularity, it's associated with how much soft tissue there is. How much soft tissue is there here? Lots. Lots of vascularity. How much soft tissue is there down here? Not much. Poor vascularity. Especially true in horses. The further you get distally and with less soft tissue, the lower the vascularity and the slower the wound heals. Okay, so distal extremity wounds on the horse and even the dog are much harder to heal than wounds on the torso or the upper leg. Okay, other things that impair healing: nutritional status of the animal. If an animal's starved or protein deficit, it's going to heal more slowly. If they're diabetic, or if they're cushingoid, or if they're in chemotherapy, or if they're immunocompromised, all those are going to affect the wound healing capabilities of the animal. So you really have to look at each patient as an individual. And in human medicine, there's whole clinics that all they do is deal with diabetic wound care. Because the diabetic gets a wound on their foot or something, it's forever to heal. It gets infected, then they cut the leg off. Okay? And the same can happen with animals if they're diabetic. So we have to look at our whole patient when we're examining wound care and why the wound isn't healing. And movement prevents a wound from healing. So if you have a wound over a joint, like a stifle or an elbow, you may have to immobilize that limb so that the injury can close. Or if you've sutured a wound over the stifle, you may need to mobilize that, or if the animal walks and bends that stifle, it may cause the wound to dehiss, or the sutures to come out, to dehiss. You guys know that term? Okay. Any questions? Are we about on? Oh, perfect.